Today we're going to talk about demyelinating degenerative disorders. These are disorders where the myelin sheath of the neuron, the axon of the neuron specifically, is basically torn away. It's degraded, and the message then that goes through that myelin, through that axon, is interrupted. And so we're going to talk about several diseases that have this occurring. Multiple sclerosis is the #1 demyelinating degenerative disorder. It's relatively common as far as autoimmune disorders go. It's an inflammatory disorder that essentially destroys the myelin on the axons of the neurons in the brain and the spinal cord. We usually don't see the onset of symptoms of MS until after puberty, usually between the ages of 20 and 40 years of age. We do see it in women more than men, but in men it is more severe and more progressive than we see it in women. As far as multiple sclerosis is concerned, it's essentially an autoimmune process that happens after some sort of insult to the nervous system. Usually a viral infection is generally the cause or the initiation of the symptoms. Early inflammation is responsible for the breakdown of the myelin on those neurons, and they produce scarring and degeneration of those axons. When that happens, that scarring is irreversible, and it interrupts the flow of the message. So the message moving down that axon is interrupted and doesn't become a clear, complete message to the effector organ. If we look at the picture that I have here over on the right-hand side, we have a healthy neuron, and that neuron, you can see all of the myelin sheath is intact, and that signal moves down that axon to our effector organ, and the message is clear and it is complete. If we come over here to the damaged neuron, we'll see that the myelin is breaking away, it's delaminating, and we also have areas of exposed neuron fiber. The message gets interrupted, it's choppy, and we don't necessarily get a complete message here at the effector organ, which then leads to the identification of symptoms. The inflammation basically causes the injury throughout the entire nervous system and can lead to what they call MS lesions. And these MS lesions are the areas of damage or scarring, or what we call sclerosis, to the central nervous system. Before the onset of symptoms, there's going to have to be some kind of event that will actually cause the activation or exacerbation of symptoms. This is usually going to include some kind of insult to the nervous system, whether it be some kind of an infection, whether it be some kind of trauma or pregnancy. Now remember, this is an autoimmune disorder, and most autoimmune disorders are genetic. And so if you are not genetically predisposed, these kinds of things are not going to cause the activation of multiple sclerosis in those that don't have the predisposition. When you see the original symptomology, the most common things that you're going to begin to see at the beginning are paresthesis, that tingling of the hands and the feet, sometimes even the arms, legs, and face. This is that tingling feeling like, say you slept on your arm wrong, and now your arm and your hand have fallen asleep, and so you've got that tingling feeling in your hand. Weakness, visual disturbances like double vision or blurry vision, and then urinary incontinence. Some other clinical manifestations with advanced MS, as MS progresses through the disease, is going to be that loss of full body control, whether it's voluntary or involuntary body control. This is what they call ataxia. And this is when you know that the disease is actually progressing beyond any kind of potential relapse. There will be slurred speech as well as tremor. There are 4 different types or subtypes of multiple sclerosis. We have remitting, relapsing, primary progressive, secondary progressive, and progressive relapsing. Remitting relapsing is the most common type of multiple sclerosis, and this is a type where the disease takes a course of stages of remittance and stages of relapse. In the stages of relapse, the symptoms are going to be worse, it's going to progress, and then we'll have other times where the symptoms will improve or even be gone, and this is what we call a stage of remittance. Then you have primary progressive. This is where you have the onset of symptoms and the disease progresses right from the very start. This is a disease that's going to progress faster and will continue with no stages of relapse. Secondary progressive is a disease progression that comes after relapsing remitting. When you have remitting relapsing multiple sclerosis, eventually your remitting phases will get shorter and shorter and your relapsing phases will get longer and longer, eventually until you don't remit anymore and you stay in that relapsed state. That is what is called secondary progressive. And then you have progressive relapsing. This is the least common. It is very similar to primary progressive, but here the progressive, the diseases progresses very quickly. It worsens from the very beginning, and you may have a stage of relapse, a stage of remitting, but then it will continue to relapse and be progressive the rest of the way through. There really is no single test to diagnose multiple sclerosis. Basically what your physician is going to do is look at family history, do physical examination, and then look for lesions with an MRI. They'll also use cerebral spinal fluid to look for IgG antibodies. About 2/3 of people that are diagnosed with multiple sclerosis will have IgG antibodies in their cerebral spinal fluid. Those antibodies are what are triggering that autoimmune response. So this is a very good target then for treatment. The treatment goal is the prevention and exacerbation of the symptoms, potentially preventing any permanent neurological damage, and then controlling whatever symptoms are visible at that point. You have drugs that will be used, corticosteroids for the inflammation, trying to control that inflammation. Immunosuppressants, these will be drugs that will target those IgG antibodies. And then immune modulators, so that you can control the immune response without eliminating it completely. There are also drugs available for symptom control so that you can live a relatively normal existence. Other types of demyelinating disorders include Guillain-Barré syndrome and tabes dorsalis. Now, I apologize for that bottom picture. It is a little difficult to look at. Guillain-Barré syndrome is a demyelination disease of the peripheral nervous system. So multiple sclerosis is demyelination of the central nervous system. Guillain-Barré is demyelination of the peripheral nervous system. This causes weakness and paresthesis, and in extreme cases can cause paralysis. Back in the 1980s, there was a small epidemic of Guillain-Barré, and it was targeting people that were in their mid to late 20s, maybe early 30s, and they actually called it the yuppie disease. And what they found was that these people were basically spreading it, or they were a group that had kind of basically been the target of this disorder. It isn't communicable, but it was basically this one group of people that tended to have this disease, and so they were able to then target that group and treat. They never did really figure out what the commonality was between them, but for it was an interesting little epidemic. The last one is tabes dorsalis. This is a very rare disorder. It is a complication of tertiary syphilis. Syphilis comes in 3 stages: primary, secondary, and tertiary. Tertiary syphilis targets the posterior roots and columns of the spinal cord and causes demyelination here. One of the things that it will do is produce a gamma on the skin, and that's what you see right here in the bridge of the nose. Obviously, this person is deceased, but this is essentially what the gamma would look like. Okay, that's it for demyelinating disorders, as always, again, please be sure that you send me any questions that you have, and we will get over them as quickly as I can.